I will briefly mention three important works that have been presented here. One has been presented yesterday in the parallel session about immunity regarding the efficacy of elafibranor over 52 weeks of treatment, looking at the other response criteria other than the criteria used during the clinical trial ELATIVE. In particular, author explored the Barcelona criteria, the Paris 1 and Paris 2, the Toronto criteria, and the rate of response were confirmed the findings of the ELATIVE trial. This is obviously very reassuring. The first one will show result of efficacy and safety of elafibranor in patients with PBC after the 52 weeks of the ELATIVE trial, and specifically they will be showing the result on the 30 patients treated with elafibranor reaching the 78 weeks versus the 13 patients treated with placebo reaching the 78 weeks. And very importantly, this analysis shown that the rate of response in a per protocol analysis were pretty high. 70% in the elafibranor arm reached the endpoint versus 0 in the placebo arm. This is very important. It's a very short cohort. This is an intention. It is not an intention to treat analysis, but there are still very important data, particularly noting that 20% of patients who did not reach the endpoint at 52 weeks, they did so at 78 weeks. And the last paper relates to the symptoms controls. Specifically, we know that each control was not fully achieved in patients treated over the 52 weeks using the worst itch scale score that look at as a 1 day recall time, while the author also assessed other two measurements, the PBC-40, which is a multi-item questionnaire exploring 6 domains of quality of life of patients with PBC, specifically not just itch, but also fatigue, the cognitive impairment, the social component, and there's a 1 month recall time. And the other is the 5D itch, which is again another multi-domain questionnaire and with a recall of 1 week. And using these new tools, actually analyzing patients with moderate to severe itch, there was a significant improvement over the 52 weeks of treatment.